I'm Dr. Christopher Bates. I'm an orthopedic hand surgeon and co-founder of Better Way Medical Group. We are a group of private practice hand surgeons helping other surgeons get paid more for doing WALANT style cases in their office. Today, I want to talk to you about something that's been on my mind lately. It's come up a few times recently with new docs that are new to WALANT style cases. They ask, how do I have the conversation with the patient about doing in-office surgery? And the question that actually another doc of ours posed originally was, why do you need to have that discussion at all? And I thought that's pretty interesting. And so we talked a lot about it. And basically the idea is when you do a small soft tissue only procedure on a patient, even if you're not doing it in the office, do you ever talk to them about the location that you can do it? Do you say, oh, we can do this at an HOPD? We can go to the big hospital. We can go to the level 1 trauma center. We can go to the surgery center. No, you don't have that discussion at all. You say, hey, this is how we do it. This is what's going to happen. And the classic way of doing all these, with either LMA or general or even beer blocks and those kind of things, a lot of times that doesn't even come up in the discussion. It just says, you just say, hey, we're going to do this case. We'll talk to you about scheduling. If you're going to the ASC with, general anesthesia, you'll say you'll need a driver with you, all those things. And so we don't normally give the patients all the potential options because we know that small elective soft tissue procedures don't need to be done in a hospital, right? It's disadvantageous to the system, to the patient, to their insurance company, to the total healthcare cost. And so we, as private practice hand surgeons, we always take patients to an ASC, or most of the time if we can. And so the same exact principle applies to doing cases in the office, right? We know that it's less expensive. We know that it's lean, it's green, it's better for the environment, it's better for the healthcare system as a whole. It saves the patient and the payer money, and can be more efficient, right? And can be much more efficient, honestly. And then there's also the caveat that there are certain risks about doing it in the office that go to zero compared to going to the ASC. When we're doing these cases in the office, there is no IV. You can't get an infiltrate because there is no IV, right? You can't have vocal cord paralysis. I had a patient, about 6 months ago. She got a partial tongue paralysis and numbness. Never seen it, never heard of it, did some Googling on it, super rare from an LMA. And so sure enough, like that, those kinds of risks, even though they're rare, they go to zero. And so it makes sense that in-office, local anesthesia only cases are safer. They can be more efficient, and those risks go to zero. And so why do we need to talk to the patient about going to the hospital, going to the ASC, or doing it in office? And so what we found that's been most successful is we just tell people what we're gonna do, right? When somebody comes into my office and they have a trigger finger, I say, well, you're in luck, we do these cases right here in the office. Now we'll need to get it scheduled. We can't do it right now, but we will be able to do it here in the office. You'll come in, you can wear your regular street clothes, just a loose fitting shirt, right? You don't need an IV. You can have breakfast, you can drink water, coffee, tea, whatever you want in the morning. You just need to show up and be ready, right? We'll meet you in a room just like this. We'll poke you one time, and that's not an IV. We just need to give the numbing medicine. You should feel a poke, a burn, and then after that, you shouldn't feel any more discomfort for the rest of the procedure. Now, once we let that set up all the way, we'll get you to the procedure room. You'll be able to lay down. You put your hand out to the side, and you don't need to see anything you don't want. We can listen to whatever music you want. We can chat, we can talk, and I can answer any questions throughout that whole time. And for things like trigger fingers, I even tell them the success rate here is probably even a little bit better than doing it with you asleep, because once we do the first step in a trigger finger release, we get to test it right away. And I show them, I say, we're going to take that trigger finger and we're going to make a fist and open it, and you're going to be able to see that it's not going to click anymore. It's not going to trigger anymore. And so the success rate's probably even a little bit higher. Now after that, we get you a couple stitches in, we put the dressing on, then you get up and you get to move on with your day. And if you'd like, you can even drive yourself, right? And if you want to have somebody with you, that's great too. In our procedure rooms here in our office, we actually have one chair sitting in the corner so they can have a family member, a friend, a spouse, whoever they want. They can have them in the room with them. And we found that to be a really, really nice thing. And so when it comes to discussing with patients where to do this and how to do this, I just lay it out like that. Like, this is how we do it. It works great because of these reasons. Sometimes people have asked me in the past about, well, how many have you guys done like this? And is this your original technique? I said, no. Like, this is nothing that we created. It has been studied for over 20 years with lots of really good level 1 studies supporting it. It's just something not commonly done in the US and purely for financial reasons. This is a clear win. We're extremely passionate about it. Between myself and my partner Nathan, we've done over 4,000 cases just like this in the past 4 years. And all of those things help alleviate concerns, worries, etc. And I would say that pretty close to about 98, 99% of my patients that would qualify for in-office surgery actually end up going through with it. I remember I had this one guy who was a young police officer, and he had a bad trigger thumb. And he was extremely nervous about it. I mean, shaking. He had a sister there with him holding his hands. But after our discussion, he realized, like, wow, I don't have to get an IV. I don't have to go through nausea and vomiting after general anesthesia. There's no grogginess associated with that. I don't have to be at the surgery center for as long. I can just go to the office. I know where it's going to be. I can talk to Dr. Bates the whole time. And he actually realized, like, for him, like, this is better overall. And so we got the one poke, right? The standard, WALANT, LALAND type technique, where you feel the hole-in-one anesthesia. And he made it through that, and then the rest of the case was a breeze. And he was so grateful and so happy that we did it that way. So this has worked really well in our practice. This is how we train other docs that work with us for WALANT in-office cases to have the discussions with their patients. And it really helps the surgeon with efficiency, because you don't have to have 5 different discussions on techniques and options and all that. You just say, this is how we do it. And every once in a while, you'll have a patient who says, absolutely not. When I go to the dentist, like, I have to be put to sleep. 100%, absolutely not. Okay, that's fine. The patient always gets to choose. And then you transition that patient to the ASC or the hospital, whatever it needs to be. That technique has worked really well in our hands and the docs that we work with. So it's been on my mind for a while lately. It's come up with a few docs trying to help refine how to do this and how to make it smoother and more efficient for clinic workflow, for not spending as much time in the room, because you don't really need to. And it's worked really well for them. So I just wanted to share with you so you don't have to go through all the pains that I did. Anyways, that's all for today. If you're a private practice hand surgeon, or another good hand surgeon that wants to do in-office cases and get paid for doing so, click the contact button below, reach out to us, and we'll see how we can help. Anyways, that's it. Have a good day. Bye.